Hello guys, so let's start today's video. So, hello to everyone who is watching or going to watch this video. My name is Lisa. I'm an occupational therapist, specialized in Pal therapy, master degree in autism spectrum disorder. And today live, every Wednesday I go live basically to have this possibility to chat with you and talk a little bit about different topics and develop a little bit more of awareness about occupational therapy and my role as a therapist in the pediatrics area. Every Wednesday I will say that we have different topics, no? Sometimes we are going to be talking about autism, sometimes we are going to talk about ADHD, and sometimes we are going to be just talking about the behavior or daily life skills or how the occupational therapists basically work with pediatrics, no? In the pediatrics area. This video today I call the role of occupational therapy in supporting children with cerebral palsy. It's true that it's a topic that not often we will target it, because mainly I will say that we work with children with autism or ADHD, but also with children with a lot of sensory issues. However, we also have kids with cerebral palsy, and it's an area that it's interesting also to check around, talk a little bit, and also bring that awareness, no? Because we have a lot of parents around with a lot of questions and difficulties and so on. I am a little bit more, I will say, more known in these Wednesdays videos to talk about feeding, oral motor skills, and other strategies and tools, but I do like to work a little bit on everything and to bring awareness in different areas, I would say. So yes, let's start a little bit by introducing what is occupational therapy for those who don't know, or for those, if you are new and you have questions and you don't know exactly what is occupational therapy, that will be great for you to know. Occupational therapy, it's a big, I will say, professional field in the health department. We work in mental health, we work with geriatrics, adults, we work in pediatrics as well, early intervention, we work basically. Our main goal is to make sure that any child or person with disability will become as much as possible functional and independent. So I will say that the main point is our goal, it's always to the independency. See how we can support the kid or the adult in order to achieve that independence, and my specialization is in kids. I've been working for over 10 years now with children with different ages, different difficulties, rare disorders, neurological problems, and yes, this project came across in a very nice way to connect a little bit more with you. I have a lot of parents with who I do online sessions and I give suggestions, and we work through online platform, what it's called teletherapy. But at the same time, I was finding like a little bit, it will be nice to be more connected to you and to support you a little bit more, or maybe give you some advices in case if you are interested, obviously. So today's topic, like I said, I chose cerebral palsy, but because it's one of the topics that I didn't yet developed with you. And so if you have questions, if you want me to stop on something, if something is not clear, or you have you would like to share your experiences or whatever, sometimes we have here students, we have future occupational therapists, we have occupational therapists from other countries, which is very nice. So yeah, feel free to ask me, to write me or whatever. I always enjoy reading you. I hope you can hear me clear. Nice. So yes, from where to start with cerebral palsy? So I think the best way it will be to start by explaining what it is, or at least what it stands, no? The cerebral palsy, what it stands for. Well, it's a neurological disorder, okay, that affects coordination, affect muscle tone, affect movement in general. So we will have children who, they will have difficulties in being independent in most of the cases, and in some cases we will have maybe some difficulties in fine motor skills, some difficulties in gross motor skills. Other children who will be dependent on activities like feeding, dressing, walking, even sometimes sitting. So I will say that it's a very difficult area to explore and to just categorize it in one particular box, because every child with CP is different, and depends also on which CP you are. No, because we have 4. We have spastic cerebral palsy, we have mixed cerebral palsy, we have ataxic cerebral palsy, and then there is something called dyskinetic. Okay, so I will explain all of them, but there are 4. And sometimes I will say that I have parents who tells me like, my child has cerebral palsy, but they are not sure which type it is, or basically we just put it in this big group of just cerebral palsy, and that's it. As occupational therapist, I worked and I'm working with a lot of children with CP. Sometimes I will say that the majority are mixed, because they have something else besides cerebral palsy, and because the way how the nerve system is affected, they will be having difficulties in fine motor skills, gross motor skills, visual difficulties, cognitive difficulties. So basically the many areas will be affected. And my job as an occupational therapist, as I'm mentioning here, it will be to try to work on all these areas at the same time to make sure that we stimulate that nerve system. So I will say that usually the role of occupational therapist, you will see more online, is to work on fine motor activities, maybe to work a little bit on dressing, undressing, or feeding, etc. But I like to go to the how to put it in a more clear way. I like to work on what will make the child independent. And the main point is muscle tone, coordination, balancing, movement in general, right? So as I said before, in cerebral palsy being a neurological disorder affecting movements, affecting muscle tone, affecting coordination, most of the other activities will be damaged or will be affected. So if we don't try to work on the basics, it's going to be very complicated to achieve other results. So what I do, I always work on if there is a difficulty in muscle tone, we have to make sure that we provide activities that will reinforce that muscle tone. Okay, we're not going to start working on impossible tasks, because that brings frustration to the parents and frustration to the therapist and basically to the child as well, and we don't have any results. No? So why cerebral palsy? By what is caused? Because this we didn't say, no? So we have a neurological disorder, but it's caused by a brain injury or malformation. Sometimes parents don't know that the child has cerebral palsy till a certain age. So the child is developing first months, I will say in a typical development, and then we start having difficulties in movements. You can see that the child is not capable to hold the head, etc., etc. So then obviously the tonicity starts showing up, and this is when the parents actually realize that okay, there is a difficulty. But in most of the cases this is very rare, to be honest, as well. Most of the cases the parents are already identified from the beginning, from the child was born, from the birth, that okay, we have to check what's going on, no? Because there are certain movements or reactions that the child is not having. I always talk about reflexes, which are present always in our milestones in our development. Many times with children with cerebral palsy, or let's put it with neurological disorders, they persist through the years. So the child can be 5, 6, 7 years, and we will still have difficulties on certain reflexes that should be gone by the age of 2 or 3 months old. So this is another way to tell you how much there is brain damage, and how much or how less we can actually do something about it, or how easier it's going to be for us to work with a child in those conditions, no? So if there were a brain injury or malformation, obviously this will be the reason why there is a cerebral palsy, no? And affection in the movement, coordination, etc. Depends on the severity of the cerebral palsy. I will say it depends on the severity of the damage, no? Why the cerebral palsy was caused. We have kids who are very independent and they become very independent. Yeah, that's the reality. By certain age they manage to walk independently, and do stuff independently, and participate in sports and in other activities of the daily life, so that's great. But also we have like the other side, no, the opposite, where you have a lot of children who suffer from this difficulty, this disorder, and we will have to have rehabilitation, no, for a very long period of time in order for us to achieve the basic milestone, like sitting, like standing, or playing with the ball, or other activities. But the good thing from therapy point of view, I always say that in occupational therapy I try to push always, like I said, the basic skills. Muscle tone, the good thing of a muscle tone being hypotonic or hypertonic, depends on the type of cerebral palsy that you have or the affection that you got, will be able to be trained. What is very important is consistency. It's to continue working, especially having specialists that knows about cerebral palsy and knows how to help you. And there are a lot of physical activities. You have physiotherapists, besides occupational therapists, you have physiotherapists, you have physical therapists working on it, and there are plenty of activities and exercises to do in order for you to actually not restore, okay, but improve the muscle tone. And how we are going to do that, it's like I said before, it's going to be through different exercises and activities. Depends on the tonicity, depends, for example, if you want to work on coordination, the same. You have a lot of things that we can be doing in order to get the child to be better, no, in coordination. But this, again, the same. It's not going to happen in 1 day or 1 month or 1 year. Sometimes it takes us really like years in order to achieve a functionality of holding a spoon or playing with a ball or reacting differently, or like bubble or pronounce properly the words, etc., etc. But like I said, it depends on the severity of the case. So I cannot be talking, it's the same like when we talk about autism, we cannot be talking in general about autism because every child is different and depends on which level you are, it's going to affect you differently. So the same in cerebral palsy, it depends on the severity, we can be, working or planning our sessions from one way to another. It depends on the severity, like I was saying, coordination, muscle tone, balance will be also affected. Currently, we're having a couple of clients who have cerebral palsy, and we are working mainly on sensory stimulation and sensory stimulation, muscle tone, and movement. It's extremely important to reduce any jerky movements or stiffness. So if we're talking about hypertonia, it's extremely important to work on that tone, because being hypertonic or having jerky movements will limit our accessibility to toys, games, or any other activity that we would like to do with the child, no? So like I said, it's very important to understand what are the goals and be realistic with them. That's okay. This is something that we are doing on a daily basis. We have to be realistic with the situation that we have, be positive about it, and continue working. There is nothing much that we can be doing. And this is the reason why I like my role as occupational therapist, because I think I try always to look to the things in a most functional way possible. So independently of what is the degree of the disability or the difficulty, we always try to manage that, that positive area. Okay, maybe we cannot eat alone, but maybe we can get him to actually, push a car or flip the book, or, the pages of the book, or whatever. Many kids also with cerebral palsy have affection with vision. So this is another difficulty, right? So if we are only talking about cerebral palsy affecting the movement, that's one thing. But if we have difficulties in communication, difficulties in cognition, difficulties in vision, obviously our, not expectations, I will say, but our goals and our achievements are a little bit struggling. We will always have tried to go to the level of the reality, what is going on. And as an occupational therapist, I always try to be there to support the parents. I think the best key that we can do is actually early intervention and continue working. I always say therapy, it's not a playground. It's not like we're going to go to Miss Lisa to play or whatever. Yeah, sometimes we do fun, and we are at the end we work with kids. So yes, definitely you're going to be enjoying yourself, etc., and do some fun activities and so on. But therapy is work, and it's incredibly important to also make sure that the parents, the therapists, the educators, everybody that your child is surrounded by understands that as well. Because when we are taking it more in a play way, and that everything is, funny, etc., I think that there is room for misunderstanding and maybe, and other, I will say other maybe possibilities that you don't really want. So goal as an OT for a child with cerebral palsy will be working in everything that I mentioned before: fine motor skills, gross motor skills, sensory processing, will be working on activities of daily life. Now, when I talk about fine motor skills, I'm not talking about handwriting or holding pencil. Fine motor skills, it's actually everything that involves our hands. So it could be from holding a ball to pointing, to be able to play a piano, or any toy with sound, to be able to put the hand in the mouth, or to be able to grasp some small items, etc., etc. So this is the reason why I was saying, depends on the muscle tone of the child, we will be able or we will not be able to do certain things. And this is where the struggle can begin, no? Gross motor skills, it's not only jumping on the trampoline or, swinging or be able to run. Gross motor skills, it's this big group of skills that it's, being able to roll, being able to crawl, being able to sit, bilateral movement, coordination, all of that. So we are depends on your CP, depends on the difficulty, no? I will say we will be able to achieve more or less, or we will have to stay for a little while working on a particular goal, and maybe the particular goal is to work on sitting to make sure that the child becomes independent in sitting, to make sure that the child actually is capable to support himself. So then we can introduce some cognitive activities. We can introduce some cognitive activities. We can introduce some, toys or games, or we can work on stability. We can introduce some weight, so we can push that muscle tone a little bit better, etc., etc. When I'm talking about gross motor skills, it's true that you can be confusing with physiotherapy, it could be, but occupational therapist works a little bit different. So physiotherapy will have their goals, more physical, I will say, or mainly it's around physical. And occupational therapists, we are going to be more of a little bit of everything. This is the reason why I like our profession, and the reason why I am going live, and I bring a little bit of awareness about this level. We are going to be working more on everything from sensory point of view to the independent skills, etc., etc. Like I said at the beginning, cerebral palsy has different different types. So depend on the affection and the severity, we're going to have different movements. So for example, if we talk about spastic cerebral palsy, which will be affecting the all the muscle stiffness that I was saying before, so hypertonia or jerk movements. So the jerky movements, it's going to affect your abilities to do or to progress in fine motor abilities or independent skills. Then we have the dyskinetic one, so it's affecting more about how much you can control the movements. So you will have a lot of movements that are not controlled, and sometimes you think that the child is repeating a movement on purpose, but actually the child doesn't have control about it, and it happens a lot. We have a lot of children who will display this type of let's say involuntary movement behavior. If we are talking about ataxic cerebral palsy type, we are going to have difficulties in balance and coordination. So mainly it's affecting balance and coordination. And if obviously we talk about the last one, which is mixed, as the word says, mixed, it's going to be a little bit of mix of different symptoms that I mentioned before. So we might have involuntary movement difficulty, we might have coordination issues. At the same time, we might have hypertonia and a little bit of a mix of everything. I will say that something super important to work on from occupational therapy point of view, if you are a therapist, okay, or if you are a parent and you would like, to get a little bit more of, just not knowledge, but, different activities, it will be to work on the sensory aspect, because movement, so difficulties with hypertonia or hypotonia, difficulties in movements or coordination, etc. It's everything from the motor area, right? Everything comes from the motor. But sensory, it's like a really, for us to have a good teamwork, we have to make sure that our sensory system and our motor system works together. And sometimes we focus so much on the motor area because we want the child to sit, we want the child to write, we want the child to eat, we want the child to talk, etc., that we don't work on the sensory. But sensory displays a very important area in order for us to be able to sit properly, in order for us to be able to maintain eye contact, or be satisfied by the activity that we are doing, participate in the activity that we are doing. We have to have our senses regulated and stable. And many times when we are having such a deep neurological disorders, our senses are a little bit, like a roller coaster. It's like everywhere. So we have to make sure that if you are not going for occupational therapy, if you are not going for occupational therapy, I highly suggest you to actually go for it, because sensory area. Sensory area is very, very important. You know, we are going to talk about spiky balls, spiky cushions, deep compressions, brushing. We're going to talk about vibration. We're going to talk about visual stimulation, hearing stimulation. No, so for example, whenever we have musical toys, or whenever we have like some lights going on, activities with lights, music, etc., etc. So you will have a lot of different activities that will make sure and will improve actually the motor area. But all of this is coming from the sensory point of view. So this is when the role of an occupational therapist is very important, to work on different sensory, different tactile activities, different sensory activities, different possibilities, no? So the nervous system says, okay, so this is not just about me getting stronger in my motor area, but at the same time, it's actually discover maybe a strong texture, a soft texture, etc., etc., etc. And especially the tactile processing system. We have different systems in our nervous system, but the tactile system provides you way more information than we think. When we start working with different tactile systems, different, therapeutic putty, or maybe Play-Doh, or foam, or kinetic sand, or other tools that we use in therapy, and we can be using at home as well. It provides us information, it provides us sort of maybe alertness, or the opposite, it calms down the child, which is extremely important as well, because sometimes our muscle tone is so much affected that it doesn't let the child to be aware and present with the activity that we are doing. Sometimes the child is also affected in a way where we need to actually alert the kid and want him to be present with us, no? So yes, this is a little bit about cerebral palsy. Like I said, there is no specific thing that an occupational therapist will be doing, at least not with me. Like I said, the idea of these videos and these lives that I do, it's to bring awareness about occupational therapies. But I am an occupational therapist that I like to put my nose, let's say, they call it like that, everywhere. And I like to believe that we can work and we can help a lot of kids, and a lot of in different situations. So yes, how to improve balance and coordination. I like to use different equipments. We have different equipments, and definitely they are for that reason. Like for example, vibrating platform, different swings, balance boards, walkers, standing frames. You have a lot of adjustments and equipment that will work on adjusting your nervous system, your motor area, your sensory system as well. So definitely we have a lot of things and a lot of tools that we can be using. But like I said, I think the best suggestion that I will be able to give to an occupational therapist who is watching, or who is interested to work with cerebral palsy, is try to first study what is the difficulty, the main difficulty or difficulties, how we can center this, and how exactly through therapy we can actually help, and what is the priority. We don't have to be working on everything at the same time. It's not possible. We have to prioritize, and maybe the priority it will be the movements. Maybe the priority is to stabilize the kid, to provide a little bit of stability in his nerve system, or provide stability in his movements, or tonicity, and then or from sensory point of view, like I said before, and then maybe move on to more independency, maybe feeding, or whatever the difficulty it is, no? So yes, well, I think that's all for today. I like to to keep you too long, not to make it boring or anything like that. I hope these videos are always, helpful to some of you. If you have questions, you can always write me and, connect and, share your stories if you feel like. Today it was about cerebral palsy. I hope next week maybe we can talk about something else. Like I said, I like to discover different topics because I work with children with different needs, and it's nice to bring awareness for everybody. Some of my videos that I already post about the Z vibe or maybe other sensory activities, they are very useful. They can be used with any child. Sometimes we focus too much with autism and ADHD, but we have to forget that there are other kids with other difficulties, right? So definitely, as much as we can, we have to provide sensory input. That will be my true suggestion. Okay, so I am going to stop here. I hope to see you and to hear from you in next Wednesday. I always connect around 7:30 p.m. set. So if you have any questions and you would like to, me to talk about a particular topic, you can always write me. I am super happy to read you and connect with you. That's a little bit the idea behind this. And I will be seeing you in my next video. Thank you for watching. Bye bye. And take care.